Thank you, Madam Speaker. H.R. 6087, the Improving Access to Workers' Compensation for Injured Federal Workers Act, is a common-sense bill to improve access to care for workers under the Federal Employees Compensation, or FECA, program. I rise in support of this bill that I have co-led with my friend and colleague, Representative Courtney, and thank him, his staff, my staff, the staff of the Education and Labor Committee, for the diligent work on this legislation. The bill simply allows nurse practitioners or physician assistants to care for federal employees under the Federal Workers' Compensation Program so long, and I make this clear, so long as that care is within their scope of practice under state law. Under current federal law, only a physician can diagnose, certify, and oversee the treatment of an injured federal worker receiving compensation benefits. This requirement places an additional burden on federal employees who may have to drive great distances to receive care from an approved provider. Additionally, it limits the injured individual's choice, depriving them from receiving health care from the provider with whom they are most comfortable. A majority of states already allow NPs and PAs to diagnose, certify an injury, and oversee the patient's treatment and care for their state workers' compensation programs. So it's time that the federal government do the same under the Federal Disability Program. Furthermore, our bill will align the FECA program with other federal programs. Currently, the federal government allows care provided or overseen by PAs and NPs in Medicare, Medicaid, the Federal Employee Health Benefits Program, and TRICARE. Additionally, since 2017, the Social Security Administration has considered PAs and NPs, along with physicians, as acceptable sources of information for documenting the existence of an impairment for purposes of determining a disability. Madam Speaker, across the country, nurse practitioners and physician assistants provide critical care, especially in rural communities where there may not be a physician within a reasonable distance. In Michigan, there are 5,300 practicing physician assistants and nearly 9,000 nurse practitioners. They are an important part of our primary care workforce in our state. Our bill represents or updates federal law to grant federal employees more choice in selecting their health care provider, improve access to care, and enable better continuity of care. Again, I sincerely thank my colleague, Representative Courtney, and his staff for their great work on this bipartisan, common-sense bill. I urge all members to support it, and I reserve my time.
Gentleman from Michigan reserves.